Core Measure 4, ePrescribing. The objective of Core Measure 4 is to ensure that providers are transmitting their permissible prescriptions electronically through the EHR system. The measure requires that more than 40% of permissible prescriptions written during the reporting period are in fact transmitted electronically through the EHR. When it comes to counting your requirements for attestation, the denominator for Core Measure 4 is slightly different than some of the other denominators of the other measures. Whereas other measures are looking at the number of patients treated or the number of office visits rendered or things of that nature, Core Measure 4 is looking only at the permissible prescriptions that were written. By permissible, it means non-DEA class controlled substances. So your standard drugs such as antibiotics or analgesics or things that are not of a controlled substance nature are qualified within this denominator. The numerator then is looking only at those permissible prescriptions, so it's ignoring all of your controlled substances overall. But within the permissible prescriptions, the numerator is going to verify which ones you did actually transmit electronically. Now that consists of having a pharmacy selected on your prescription that in fact is capable of accepting electronic prescriptions. Many providers will not put a pharmacy on their prescription because they just give it blankly to the patient and let them go to whatever pharmacy they choose. When it comes to electronic prescriptions, however, a pharmacy is required, and that pharmacy must be equipped to take prescriptions electronically. So that is the only area whereby your numerator within prognosis could be less than 100%, is in the situation where the drug is permissible to go electronically, but you have either not selected a pharmacy at all, or you have selected a pharmacy that is not capable of taking e-prescriptions. Otherwise, this measure in itself is one of the easiest to actually have 100% on, because the way prognosis has written the e-prescribing module, if you have an e-prescription pharmacy and an e-prescription drug, we force you to send it electronically. Now, with regards to exclusions, many of our providers, especially in the pain management world, or surgeons, things of that nature, where the specialty seems to lend itself more into the controlled substance area, where the majority of your prescriptions are actually narcotics. The opinion was that perhaps they could be excluded from this measure. Many of those doctors, in fact, have such a low non-controlled substance volume that they don't even set themselves up with e-prescriptions when they go live with us. However, e-prescribing is a mandatory measure of meaningful use. Therefore, regardless of your specialty, it is something that you must do. So the exclusion criteria is the same as what we discussed in video for Core Measure 1. If, as a provider, during your reporting period, the total number of prescriptions that you write is less than 100, then you can exempt yourself. However, there's a fine line here where CMS has written the exclusion as stating 100 prescriptions during the reporting period finitely. It's not excluding narcotics in the exclusion provision. So as a provider, if you write 1,000 prescriptions and 950 are narcotics, so only 50 of them are permissible, you do not qualify for the exclusion. You simply will have a low number of 50 as your denominator. And out of that 50, you will have to exceed 40% going electronically. So as we toggle into prognosis, we're going to go to our patient Johnny measure and go to his prescription screen. And first for criteria, as I mentioned, is the pharmacy. So you'll see here in the case of Johnny, his pharmacy is already defaulting from previous prescriptions. And to the left of the word pharmacy, we have the label ERX. If your pharmacy does not exist, or if your pharmacy chosen does not have that ERX label, it is not going to be counted into your numerator. Even if the drug is permissible, the absence of a pharmacy that is permissible will cause the prescription to be excluded from the numerator, even though it may be included in the denominator. We're going to just write a simple prescription here for some amoxicillin. We're just going to go ahead and update it. and save it. Now, I am logged in here as Dr. Cooper, so I have save and approve rights. Remember that with regards to compliance of prescription orders in prognosis, you do have the 3 steps of updating the drug to the prescription, saving the prescription to the patient, and then ultimately completing that prescription. In this case, with Measure 4, we're going to complete it by ePrescribing it. So notice our checks, our pharmacy is ERX, and then down here below in our drug table, notice to the left of our drug name, we also have an ERX indicator as the type. So those 2 factors will not only count this drug in the denominator because of the drug type, but it's also now qualified for the numerator because the pharmacy is ERX. So just to demonstrate how the system is going to force that, if I try to print my prescription, it gives me a warning that I cannot print an ERX drug. So now I'm going to have to click my ERX icon. When I click that, I get this confirmation window prior to the transmission, just so that I can re-verify what the drug is, what the patient's information is, what pharmacy it's going to go to. And then I simply click the send button. Once my system refreshes, what it is doing in the background now is generating that electronic prescription, and notice I get a confirmation on my screen that the ERX was sent successfully, and in this case has actually already been accepted and verified by SureScript. And down here below, if you notice again in my drug name, I have a check mark next to the name of the drug to indicate the prescription's completed, and then I have another indication of ERX which substantiates for me informationally that not only was that amoxicillin prescription completed successfully, but it had done so ERX. So in the case of Measure 4, this is compliant at 100%. You have a singular drug that is permissible, therefore it's in the denominator, a singular pharmacy that is ERX capable, and you have completed the prescription. Therefore, you're at 100%. Now, just to demonstrate the other exclusion part of a non-permissible prescription, we still have our ERX pharmacy here for Johnny, but I'm going to add a second drug now that is actually not permissible. So I'm going to bring in the Percocet, and notice this time when my drug comes in, I have a DEA class populated. So once I update the drug to my prescription and save my prescription to the chart, next to the Percocet, you'll notice the drug type is empty because it is not an ERX drug. So not only is the type empty, but I also have a DEA class in the details. So now this is what excludes this drug from Measure 4's denominator. So it's not an exclusion from Measure 4 in itself. However, the Percocet will be ignored from counting into the attestation requirements for Core Measure 4. So in the case of Johnny Measure, even though as a patient, Dr. Cooper is giving him a singular prescription for 2 drugs, the system is counting each drug as its own individual prescription so that we can filter out permissible versus non-permissible. So in this example, even though my pharmacy's ERX, since the drug is not, I cannot e-prescribe the Percocet. And in fact, if I try, notice the system errors that it is not applicable to go by ERX. So therefore, while I have the controlled substance selected, I cannot e-prescribe it. I will have to print it or fax it, of course. And then with regards again to the meaningful use criteria, the Percocet's completely ignored both from the denominator and the numerator. So to summarize, if we go back in here to our presentation, the compliance checklist is, first of all, your drug on the prescription must be a non-DEA class controlled substance, and it has to be entered into the digital structured computable format fields. You have to remember to select a pharmacy that is ERX enabled, and then you must click the ERX button to transmit that prescription. And keep in mind again, as we show in the red box, it will be excluded from the numerator if there is no pharmacy chosen or if the pharmacy chosen is not ERX enabled.